coverage you can count on continues now with new information on our continuing investigation into reports of abuse and deplorable conditions at Augusta State Medical Prison in Grovetown. Right now, News Channel 6's Ann Maxwell joins us live from outside the prison on Gordon Highway. Ann?
I spoke with Dr. Timothy Young on the night before his last day of work at Augusta State Medical Prison after 16 years of working here. He says he tried to shed light on issues with the facility back in October, but faced retaliation. And at the end of December, he turned in his resignation letter. Now, I have also heard complaints about the facility here from several former correctional officers as well as the mothers of inmates. Debbie Whitlock has no illusions about who her son is.
My son is a repeat drug offender. He's an addict and a dealer, methamphetamine.
Anthony is an inmate at Augusta State Medical Prison. He's also a father. Debbie now has custody of his 3-year-old daughter, Georgia.
My daddy loves me so much.
He's also sick. Debbie debated whether she should even let Georgia visit him because even though he's up for parole in a few years, she's afraid his time at ASMP will turn into a death sentence.
I fear for his life that he might go low. He's a type 1 diabetic and nobody's coming.
Debbie says his kidneys have been failing since before he was arrested in 2016. Former Augusta State Medical Prison Dr. Timothy Young says the healthcare system at the facility has a lot of problems, from black mold to lack of security officers to a backlog of 1,000 requests for medical care.
There are more patients than I can remember right now or count who, by the time we got them up, they went directly from my clinic to MCG.
These hospital visits come at the expense of patients' health and taxpayers. Debbie says her son ended up in the hospital last year, even though she had been in touch with administrators about her son's health problems for months.
If you have a family member that goes to the hospital or is really sick, you're not going to get to see them, you're not going to get to talk to them. It is like pulling teeth to get information. It's the most scary, horrible thing I've ever been through.
Dr. Young says one reason for the backlog is security issues. High-risk inmates must be escorted to the medical area by a security officer, and there just aren't enough of them, Young says.
My job became calling someone high enough up the security chain to make lower security officers bring those inmates up.
And when inmates do end up in the hospital, 2 security officers have to go with them. When we spoke with Dr. Young earlier this week, he said the operating room was also offline.
They're not doing cases in it because of a maintenance issue that has been known about for quite some time.
He says they are also short of physician and bed space.
So someone would bring me a list and say, okay, we have 4 beds available to put these patients into, and we have 15 cases canceled, or we have 15 cases scheduled. Which 11 do you want to cancel?
He showed us one email he sent about inmates being rescheduled up to 23 times because security failed to bring them to appointments.
It's a multifaceted problem. And it's getting worse because now you have a facility that can't even handle the cases that can be done there.
In the meantime, Debbie worries about her son hanging on for the next few years, and Georgia dreams of seeing her daddy again on the outside.
He just wants to be with me so loudly.
The Department of Corrections has not responded to our calls or messages. However, the department's top health official did tell the Atlanta Journal-Constitution that he is personally overseeing a plan that he hopes will improve safety and sanitation at the facility. Dr. Young says he has not seen any details of that plan and he has no faith in it. We also reached out to that health official, Randy Sauls, as well as Augusta University, which oversees Georgia correctional health care. We will let you know if and when they get back to us. Reporting live in Grovetown, Ann Maxwell, WJBF, News Channel 6.